Good evening, ladies and gentlemen. I'd like to introduce you to Luke Logan. He's a member of Midway's baseball team, and he also recently just became a member of the Midway men's track and field and cross-country programs, so expect to see Luke competing on a lot of different fields for Midway next year. He is doing his presentation here today on why the United States should not have a draft. So please give it up for Luke. Thank you guys and enjoy. Hi, my name is Michael Martin, and this presentation is called Love on the Brain. It is about why I believe that epilepsy research should be getting more funding from the government. First off, I'd like to mention that this presentation is kind of personal to me because I myself have epilepsy, and I've had it since my sophomore year of high school, so I've had it for about 3 years now. So what exactly is epilepsy? According to Fisher, 2016, epilepsy is a disease characterized by an enduring predisposition to generate epileptic seizures and the neurobiological, cognitive, psychological, and social consequences of this condition. There are two types of seizures. There's focal and generalized, and we'll try to focus it there a little bit. And there are two different types of subtypes of focal seizures. 15% have simple focal seizures, and 3% have dyscognitive partial seizures. Grand mal seizures are the most common form of generalized seizure, and it's the most common form of seizure overall. They're actually the seizures that I have. In the event of a seizure taking place, a person will have a staring spell for about 5 to 10 seconds and then drop to the floor and begin convulsing for about 45 to 60 seconds. In this time, a person has a chance of losing their bladder, foaming at the mouth, and choking on or biting their tongue. For the general population, most direct healthcare costs are about $10,000 to $48,000 a year, plus an extra $8,000 to $11,000 in epilepsy-specific costs. So tends to add up pretty fast, but those costs are just pulled from patient to patient. And across America as a whole, Americans tend to spend $15.5 billion a year on treating and controlling epilepsy. So, what are the odds that you or someone you know could have epilepsy? First off, it's the fourth most common neurological disease in America today. It affects roughly 2.5 to 3.5 million people a year. Now that number is only 1% of America's total population, but the odds of developing epilepsy are 1 in 26, so that comes out to about 150,000 new cases a year. And California is the most affected state in the United States, as of 2016, according to 2016 data, they had 427,000 cases in the state of California across adults and children. Sorry about the zoning out. That's another thing that I have trouble with due to the epilepsy. So mind games. Epilepsy has a tendency to lead to a lot of psychological problems. Some of those including depression, ADD, anger, and anxiety, aggression, things like that. Depression is most commonly caused in patients during the periods between seizures, and a lot of times it goes untreated. A lot of times, they just don't speak up on it. ADD and aggression are commonly behavioral problems in children with epilepsy due to their lack of control over and over the unpredictability of seizures and the inability to detect an onset of one coming. It's very frustrating, trust me. And other real-life complications that people with epilepsy face are it is much harder to obtain a driver's license because most states will not hand out a driver's license until you've been seizure-free for a specific amount of time. In the state of Kentucky, it's 90 days. Trust me, it's a hassle. Other things are we are 15 times more likely to drown due to the loss of control we can have of our body and our awareness when a seizure tends to hit. There's also an increased risk of falling down because of the loss of motor functions that we experience when a seizure takes place. So, is there a cure? The answer is no. The first approach that a neurologist is going to try is called, according to the Epilepsy Foundation, it is called the no seizures, no side effects method, which means that they will try different medicines or combinations of medicines to try to make sure that you can stay seizure-free as much as possible with as little side effects as possible. I actually take this right here. It's almost empty. I need to refill it soon. But it's a 750 milligram tablet. It's called Keppra. I take it once in the morning and once at night, and its only side effect is increased irritability. So that's a ride, isn't it? Now this approach is mildly successful, but it also comes with many different side effects like dizziness, blurred vision, and then there's certain uncommon ones like rashes or liver problems, and sometimes drops in white blood cells and platelet counts. One of the other treatments is called vagus nerve stimulation, and as Kimberly Holland described it, doctors implant a device right under the skin and of the chest, and the device sends electrical bursts through the nerves and into the brain. These electrical pulses have been shown to reduce seizures by 20 to 40%. And epilepsy funding, according to a budget report by the National Institute of Health in 2016, epilepsy receives $153 million in government funding, and in that same report, prostate cancer receives $253 million, and schizophrenia receives $268 million. Now, why did I pick those, you might ask? Because in the same time span of epilepsy development, where it is at its peak, is 0 to 50 years, and as stated earlier, there is a 1 in 26 chance of developing epilepsy. In that same time frame, you have a 1 in 403 chance of developing prostate cancer. Prostate cancer also has a 99% survival rate and a known cure at this point in time. 2.6 million adults currently live with schizophrenia in their daily lives, which is around the same number as epilepsy. And according to the National Mental Health Council, treatment success rates for schizophrenia are comparable to the treatment success rates for heart disease. So there is a cure. So there's no cure, but it is very much highly treatable. Here are all my sources that you will find, and my name is Michael Martin. Thank you for your time. Have a good one.